Well, time to talk a little healthcare. And as I mentioned before the break, we're often talking about horror stories, people that cannot get family physicians, that are looking for primary care. We talk about patients in overcrowded hospitals waiting for diagnostic tests. But today, we're talking about a primary care network that is really trying to make a difference and trying to bring better healthcare to people and also reduce the workload on physicians. And to talk more about the North Shore Primary Care Network, we are joined now by Dr. Dean Brown. Dr. Brown, thank you so much for being here.
Hi, Jill. Thanks for having me.
Before we get into some more of the details, can you explain exactly what is the North Shore Primary Care Network?
Yeah, thanks for asking. Actually, primary care networks are an initiative throughout BC. It isn't only a healthcare thing happening on the North Shore. And the intent behind it is really to try and establish a kind of a different approach to primary care, which is to create team-based care so that it isn't only a doctor connecting with a patient, that the doctor is maybe supported by other healthcare providers around them in a close kind of network or affiliation of care to give the person what they really need. So as I say, it's a provincial thing, and we're doing what we can to make that happen on the North Shore.
And has it been in place for some time now as far as connecting people maybe that don't have a family doctor or have specific health needs? How long has this been operating?
It's probably been up and running really well for maybe 2 years or so, 2 to 3 years. We actually had the plans for it in place back in 2019, 2020, but then the virus thing came along, COVID, and that put a delay into it. So we've really been up and running in the best way, probably for something in the zone of about 2 years.
And have you seen successes, or how has the program actually worked and helped people in those 2 years?
Well, the surprising thing is that we've managed to establish something in the order of 25 to 30 new primary care providers on the North Shore. So that's a combination of family docs and nurse practitioners who are willing and able to take new patients into their practices. And that's a real game changer, because 5 years ago, there was essentially no one, and people were retiring from practices, and the situation's getting worse. And that's not to say that we've solved things by a long, long way. There's a long path ahead of us to change the primary care and the healthcare system. But we're now managing on the North Shore anyway to attach something in the order of 1,500 to 2,000 patients a month to a long-term provider.
And like you said, so it doesn't solve all of the problems, but certainly that sounds very promising. What was it about the network, or then how were you able to attract the 25 to 30 primary caregivers to this type of model when we're seeing in so many other areas that that's not happening, that's being very, very difficult?
Well, it's really, I think, two things. The biggest thing that happened in the last year or so is a new payment model that addresses primary care in a different way. And what that's put in place is, instead of the old fee-for-service model, which we've had kind of forever in BC and across Canada, is to say, well, there's time spent looking after people that isn't apparent. So the kind of looking at labs, writing consult letters, reviewing things, talking to other people about, we need to do this, we need to do that. Those things haven't been recognized in the payment models in the past, and now that is being recognized. So the time spent, which people don't appreciate, but there's a lot of that, is now being recognized in the new payment model. So frankly, the pay is a lot better for family doctors now than it was 2 years ago. This just came into place, I guess, about a year ago, February 2023. So that's been a game changer in BC, and hopefully that kind of model and rethink will happen across Canada. And that's part of it. That's 50% of the battle, I think. The other 50% is establishing a more team-based care environment so that we can use other professionals in looking after people, especially when they have more complicated healthcare needs.
And we've certainly heard that from, especially from family physicians, as well from specialists in the past, that whether it's a physician assistant or somebody to be part of a team to take some of the load off primary caregivers. Is that what you're seeing as well in this kind of network?
Yes, we're establishing that on the North Shore. Different communities are doing it in different ways across BC and, frankly, across Canada. Because it's a real rethink in how we do things. But on the North Shore, what we've done is nurse in practice so that doctors can apply and say, I could use a nurse in practice. And nurses are highly skilled professionals and can do all kinds of things. And another thing that we heard from our members when we were getting these things established a few years ago is, for heaven's sakes, give us help in the mental health care arena. We see so many people with mental health challenges in our practices that we just need a lot of help on that one. So we were able to put in place something that we call a mental health clinician, which is kind of a new role of a mental health provider closely connected with a family doc or a nurse practitioner in their practice, so that you have a team-like relationship and you can refer people with mental health or social support challenges to these counselors. And they actually happen to be social workers as well as trained counselors, so they can offer quite a good breadth of support. And then the third thing that we've put in place on the North Shore is pharmacists. And these are people with a lot of training, PharmDs, as we call them, doctorate in pharmacy. So they're very knowledgeable. They've worked in hospitals and that sort of thing. And we can turn to them with complicated problems in the whole pharmacy realm and say, what do we do with this person? They're on 10 medications. I can't even remember why I put them on all 10 of these medications. Can you help us figure this out? So they're a wonderful resource. So all of those things are being put in place. So we've got something along the line of about 110 doctors' practices who are using these folks along the way.
And it's so interesting to see that kind of integration and that kind of teamwork, because I know one of the other issues that was addressed by this was the highly skilled professionals, like you just mentioned, whether it's nurse practitioners, pharmacists, mental health clinicians, not practicing to their full scope. And have you seen that while this has been set up or this is in place, that's kind of been remedied and people are practicing to their full scope, which again is going to relieve some of the overload on other health professionals?
Yeah, we're seeing that happen, and we're seeing some wonderful examples of that on the North Shore. We're also seeing, interestingly, the challenges with that, because sometimes if you put a nurse into practice, it makes sense, and everyone sees that there could be value in that, but figuring out the details, how is this nurse going to work with your patients on a day-to-day basis? Exactly what are they going to do? How will that offload the physician? We're working on that, and that's part of the path that we need to take together, is figure out how does this work in detail, because those details really matter, and these professionals have a breadth of skills, and how you implement that in practice can make a difference. But we're definitely seeing it, and there's a lot of excitement with some of these, with a lot of the professionals that we're working with, to say that they're working differently and finding it a really gratifying model of care.
So it sounds like it is working very well for the health professionals. You talked as well about the number of people who've been able to access primary care physicians and other primary care professionals. Where do you see it going from here as far as will it expand? Will you see more people perhaps that don't have a family physician be able to get one or have access to one?
Yeah, that's absolutely the hope, because we see that primary care, a family doctor or a nurse practitioner, is absolutely the cornerstone of the healthcare system. If people have careful, coordinated care from someone who knows them, that helps them navigate the whole healthcare system in a much better way. So we are seeing that more people are able to find family physicians on the North Shore. We're able to attach something like 1,500 to 2,000 people a month with our current attachment process, which is wonderful, but we don't pretend that this is the solution to all of the healthcare system's problems. But we do believe that a lot of the problems for the healthcare system, whether it's the hospital or other parts, really can be solved in the community. And if we get this part right, there'll be a trickle effect through the healthcare system. But that'll take a few years to happen.
Well, you mentioned that other areas were doing similar networks or similar types of primary care networks. Is this happening, do you see, in other parts of the province, or do you think that it will be set up, or this will could become the model?
Yeah, it's taking place across the province. So the intent is that all communities will have this kind of capacity, and they're taking it up in different ways because every community is different, and the rural communities are different from the urban communities and so on, and every community is unique, so every community has to think its way forward how to do this in the best way. But it is happening across the province, and it's the right path.
Well, Dr. Brown, thank you so much for taking some time today to talk more about this and show what kind of progress is being made with this network. I appreciate you taking the time. Thank you.
Okay, thanks, Jill. My pleasure.